Assalamualaikum and hi parents, my name is Kamilia and today we will talk about Autism vs Asperger's. A lot of people seem to be confused between these two, but today we will see the definitions and the differences between autism and Asperger's. What is autism spectrum disorder or ASD? ASD is a neurological and developmental disorder that affects how people interact with others, communicate, learn, and behave. Although autism can be diagnosed at any age, it is described as a developmental disorder because symptoms generally appear in the first 2 years of life. Autism is known as a spectrum disorder because there is a wide variation in the type and severity of symptoms people experience. There are two types of symptoms of autism that can be seen in your child. First is social communication, and second is repetitive or restrictive behavior. Social communication, your child might make a little or inconsistent eye contact. They may appear not to look at or listen to people who are talking. They might also have infrequent sharing interests, emotion, or enjoyment of objects or activities, such as infrequent pointing at or showing things to others. They might also not respond or being slow to respond to one's name or to other verbal beats for attention. They might also display facial expressions, movements, and gestures that do not match with what being said, such as if they are sad but they are laughing. Sixth is they have difficulties with the back or forth of conversation. They might also have often talking at length about a favorite subject without noticing that others are not interested or without giving any chance for others to respond. For repetitive behaviors, they might repeat certain behaviors or having unusual behaviors such as repeating words or phrases, or also known as echolalia. They might also have a lasting intense interest in specific topics such as numbers, details, or facts. They might also show overly focused interests such as moving objects or parts of the objects. They might also become upset by slight changes in their routine and have difficulties with transitions. Last but not least, they might be more sensitive or less sensitive than other people to sensory inputs such as light, sound, clothing, or temperature. Well, what are the causes of ASD? Researchers don't know the primary causes of ASD yet, but studies suggest that a person's genes can act together with aspects of their environment to affect development in ways that lead to ASD. Some factors that are associated with an increased likelihood of developing ASD include having a child or sibling with ASD, having older parents, having certain genetic conditions such as Down syndrome, and also having a very low birth weight. What is Asperger's? Asperger's syndrome is the developmental disorder where young people with Asperger's syndrome have a difficult time relating to others socially, and their behavior and thinking patterns can be rigid and repetitive. Generally, children and teens with Asperger's syndrome can speak with others and can perform fairly well in their schoolwork. However, they have trouble understanding social situations and subtle forms of communication, such as body language, sarcasm, and humor. They might also think and talk a lot about one topic or interest, or only want to do a small range of activities. These interests can become obsessive and interfere with everyday life rather than giving the child a healthy social or recreational outlet. Boys are to 4 times more likely than girls to have Asperger's syndrome. Most cases are diagnosed between the ages of 5 and 9, with some diagnosed as early as age 3. These are the symptoms that might have or appear in someone who has Asperger's. Firstly is inappropriate or minimal social interactions. Second is conversations that almost always revolve around themselves or a certain topic rather than others. Third is not understanding emotions well or having less facial expressions than others. Fourth is speech that sounds unusual, such as flat, high pitched, quiet, loud, or robotic. They might also not use or understand nonverbal communication, such as gestures, body language, and facial expression. They might also have intense obsession with one or two specific narrow subjects and becoming upset at any small changes in routines. They might also memorize preferred information such as facts easily. They are clumsy, uncoordinated movements, including difficulty with handwriting. They have difficulty managing emotions, sometimes leading to verbal or behavioral outbursts, self injurious behaviors, or tantrums. They might also not understand other people's feelings or perspectives, and they have hypersensitivity to lights, sounds, and textures. So, what are the differences between autism and Asperger's? Autism is a mental condition present from early childhood characterized by great difficulty in communicating and forming relationships with other people and in using language and abstract concepts, whereas Asperger's is a developmental disorder related to autism and characterized by awkwardness in social interaction, pedantry in speech, and preoccupation with very narrow interests. Autism indicates severe symptoms and signs compared to Asperger's, whereas Asperger's indicates very mild symptoms and signs compared to autism. Autistic people usually prefer to stay isolated from the society, whereas patients with Asperger's prefer to move along with the society and interact. Children with autism tend to have a very difficulty in language delay or start talking later in life, whereas children with Asperger's display language skills, although they might use language in a different way. How to get diagnosis if your child show any symptoms of Asperger's or autism? There are two stages. First stage is general developmental screening during well child checkups, where pediatrics usually recommends that all children receive screening for developmental delays at their 9, 18, and 25, 24 or 30-month well child visits, with specific autism screenings at their 18 and 24-month well child visits. A child may receive additional screening if they have a higher likelihood of ASD or developmental problems. Children with a higher likelihood of ASD may include those who have a family member with ASD, show some behaviors that are typical of ASD, have older parents, have certain genetic conditions such as Down syndrome, or who have a very low birth weight. Second stage is additional diagnostic evaluation, where a team of healthcare providers who have experienced diagnostic ASD will conduct the diagnostic evaluation, where this team may include child neurologists, development pediatricians, speech language pathologists, child psychologists or psychiatrists, educational specialists, and occupational therapists. The diagnostic evaluation is likely to include medical and neurological examinations, assessment of the child's cognitive abilities, assessment of the child's language abilities, observation of the child's behavior, and in depth conversation with the child's caregivers about the child's behaviors and development, and also assessment of age appropriate skills needed to complete daily activities independently, such as eating, dressing, and toileting. These are some of the treatments that can be done if your child has autism or Asperger's. First is applied behavior analysis or ABA, where it teaches individuals new skills and prevents behavioral issues by using positive reinforcement. It also offers systematic teaching and breaks down positive behaviors into manageable segments. Second is occupational therapy or OT, where it aims to enhance fine motor skills, coordination, and sensory integration. Third is cognitive behavior therapy, CBT, where it helps creating strategies for handling stress and anxiety and also controlling their emotions. These are some of the comorbidities if your child has autism or Asperger's. First is OCD, second is schizophrenia, third is depression, fourth is epilepsy, and fifth is ADHD. That is all from me today. Thank you. Bye bye.